We're going to now run a film clip from Oregon NORML's Medical Cannabis Award panel. I believe this one has some physicians. We'll discuss it when we come back. Hope you enjoy the clip.
The psychiatry that I used to know does not exist anymore, which is talk therapy. And it's all pill pushing. It's all medication. And to that end, we really don't know what is happening, and this extends not just to psychotropics, but I'm going to read you a short letter to John A. Kitzhaber, MD, Director, Center for Evidence-Based Policy, Oregon Health and Science University. And this is who I suggest if you want to contact to embarrass a little bit. On February 25th, I happened to view a panel presentation by your organization on C-SPAN on the cost-benefit study of different pharmaceuticals contracted by AARP. The sum total of that panel was they could not develop any cost-benefits analyses because in analyzing the pharmaceutical literature, they discovered it was all promotional rather than objective and scientific. So everything masquerading as science is not. So based upon California clinical experience with a range of chronic conditions, our findings indicate a significant advantage over other pharmaceuticals conventionally utilized because of improved quality of life and fewer adverse effects. Consequently, we request the opportunity to discuss our findings with you. Attached is a list of conditions. And guess what the response was? So I'm glad this is going over cable TV in the Portland area, and hopefully somebody out there in the viewing audience can give the center a call and ask them to include cannabis in their studies, and especially about the mental health issue. I would be fascinated to hear the response, but I won't hold my breath.
May I interject just very briefly that obviously there's so much reduction in pharmaceutical use that it's an enormous opening for research, which unfortunately physicians who are taking care of patients in a primary care setting, they don't seem to be monitoring the change in prescription drug patterns of their patients before and after they become members of the OMMP. And it's remarkable because these patients are they're basically reducing opiates tremendously, and actually there's research I'm sure you guys are all aware of about the synergistic effects of the receptor effects of opiates and cannabinoids, where they basically are hitchhiking with each other, and much smaller doses of both medications create the same benefit with, of course, much less side effects. These are really remarkable findings, and I really regret that there aren't physicians who are just monitoring the reduction in the prescription patterns of their patients. If they doubt that cannabis is useful, I would encourage them to please do so, and just, a before and after evaluation of their prescriptions will show how much reduction or how much change there is. But it's really a lost opportunity. There's a lot of possibilities.
You know what you just said, you think that's new? If you read marijuana medical papers, in the Ohio State Medical Society meeting on cannabis in 1860, a Dr. Frommuller from Ohio reported that using an alternating courses of opiates and cannabis for treating chronic conditions reduced dependence on opiates. 1859 this was written. And so, this is something new. No, we're talking about the takeover by Big Farm and ruining policy through their special interest money. And furthermore, the fact that this whole system, can I use the my favorite
Oh,
phrase.
why not?
Monomolecular mercantile madness. This is all patent office driven. If you look back to what it was before the single molecule ascended to its role in current commercial medicine, you'll see that it's all secondary to what can get patented. And then they claim that the newly patented material is increasingly better, blah, 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 but then you see what's happened to the literature. It's gotten thoroughly corrupted and perverted so that you don't know what's happening, and here we have now a drug-seeking, drug-hungering public convinced that they need all sorts of combinations of patentable materials. And it's really sickening our society. And when they started directly advertising to the public, for psychotropics especially, ask your doctor. Social anxiety disorder, all these kinds of influences to influence you and their bottom line.
Any other questions?
Okay, that was Dr. Tod Mikuriya, who wrote medical marijuana papers back in the early 80s. And directly to his left, that was an RN by the name of Ed Glick. To his right was Dr. Rick Baer, the chief petitioner on Oregon's ballot measure 67, the medical marijuana law that passed in 1998. Then the other fellow off to the side there that wasn't talking much in that clip was Dr. Cohen from Oregon, another physician who helps medical marijuana patients. How are you doing, Don?
I'm great, Paul.
It's good to see you. Don Dupay here is currently a social worker, but he's also a retired Portland police detective with, what is it, a 17